Good morning, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health, along with Trevor Mcpherson, the President and CEO of the Mississauga Board of Trade. Before I give my COVID update, I first want to say that the City of Mississauga grieves with the members of Williams Lake First Nation in BC as they begin to confront the horrific tragedies that took place at the former St. Joseph's Mission Residential School. Our thoughts are with all the survivors of the residential school system in our community and across Canada. This is one of the darkest chapters in Canadian history, and only by unearthing and understanding the full truth of what took place can we begin to have meaningful and lasting reconciliation with Indigenous communities. Our flags have been lowered to half-mast to honor those who never came home from the St. Joseph's Mission Residential School. And we stand in solidarity with all members of the Williams Lake First Nations and all residential school survivors. Mississauga, we're approaching the 2-year mark of the pandemic, and I know a lot of people are tired and frustrated. The last few months have been particularly difficult. As soon as we thought we'd seen the worst, the arrival of the Omicron variant changed the game, and we saw widespread transmission across the country and in our community. But I'm starting to feel more and more optimistic about the future. Earlier this week, we reached a very significant milestone here in Peel Region. 90% of Peel residents 12 and older are now fully vaccinated. Reaching this level of 2-dose coverage has always been a major goal right from the outset of the vaccine rollout. And I want to thank each and every resident in Mississauga for stepping up to protect their family, their friends, and their neighbors. I also want to thank Dr. Lowe and the team at Peel Public Health, the staff at Trillium Health Partners, and all of our physicians, pharmacists, healthcare workers, volunteers, and the dozens of businesses and organizations who helped get shots in arms. This level of community protection is going to help keep schools open and businesses open. It's also going to help take unnecessary pressure off our hospitals. The good news is that while the situation at Trillium, like so many hospitals across the province, is still very challenging, there are signs of hope. Trillium has seen a significant decrease in the number of COVID hospitalizations compared to just a week ago, as well as more and more staff returning to work after having had to isolate due to illness or exposure. It's hard to express my full gratitude to everyone at Trillium for continuing to provide our community members with exceptional care under extraordinary circumstances. You've shouldered so much over the last 2 years, and your resilience and perseverance is an inspiration to us all. Because of the promising trends, not only here, but across Ontario, I believe the time is right to gradually reopen businesses. I'm very thankful we got the news late last week from Premier Ford that restrictions will begin to ease this coming Monday. Here at the City of Mississauga, that means we are once again able to open our doors at our community and cultural centres, including our fitness centres, arenas, pools, gymnasiums, museums, theatres, and libraries at 50% capacity. Importantly, though, proof of vaccination with a QR code will still be in effect. Meeting and event spaces are also available to be booked at 50% capacity starting on Monday. As Mayor, seeing the closure of our recreational facilities at the beginning of this year was incredibly tough. And I know so many residents rely on them for their physical and mental health. So I'm extremely relieved that these important services are going to be back up and running. And of course, I'm happy that restaurants, bars, gyms, and theaters will also be able to open their doors with capacity limits on Monday. I want to thank the province for giving business owners advance notice to allow them to ensure that they have proper staffing and resources in place. The reality is that restaurants and gyms in Mississauga have faced longer closures than anywhere else in North America. And the reopening on Monday will allow many of them to begin the road to recovery. But I really can't stress this point enough. We have to ensure that this reopening sticks. Our small business owners simply can't afford another lockdown. We have to keep moving forward. And I think the best way we can continue moving forward is by doing so cautiously and gradually, and by continuing to encourage people to get vaccinated and to get boosted. The last thing we want to do is to open businesses only to have to close them again, which is why I was happy to hear Premier Ford say that he will continue to monitor the situation closely and that the dates for easing restrictions could change depending on public health trends. I encourage the province to continue to keep public health measures that we know are effective in place for the foreseeable future, including masking and proof of vaccination. If we need to stay at 50% capacity in certain settings because the trends warrant it, please don't hesitate to do so. This needs to be the last lockdown we see on businesses here in Mississauga. Our residents and businesses can't afford it anymore. The upcoming days and months are going to be critical for many of our small businesses to bounce back. They're going to need all of our support. And to provide some perspective on the challenges businesses have been facing and how we ensure that they not only recover, but once again thrive, I will now invite up the President and CEO of the Mississauga Board of Trade, Trevor Mcpherson. Trevor?
Thank you, Mayor Crombie, for inviting me to speak briefly today about the concerns and needs of our business community after two of the most challenging and, for many MBOT members and their employees, gut-wrenching years of uncertainty due to pandemic-related impacts on their operations. I would like to begin by emphasizing that MBOT fully understands that public health and the health of our business sector and overall economy are inextricably linked. We don't have one without the other. This has not been clearer than in what we have seen in recent weeks, with staffing shortages and supply chain issues being an everyday reality. This said, government decisions on closing and reopening businesses, implementing capacity restrictions, and related measures have had some devastating impacts on businesses across all sectors of the economy. The Mississauga Board of Trade has proudly been a champion for our business community, and we would like to thank the Mayor, members of Council, and City staff for working with us and offering their leadership and support during these trying times. In addition to our advocacy and efforts to provide both timely information and access to expert knowledge on a range of topics from labor law to managing remote teams, we have distributed over 250,000 rapid antigen kits to businesses, and we look forward to continuing this service. Over the last several months, MBOT has led a very successful Shop Local Mississauga campaign. We have been inspired by the residents of this great city who have stepped up to shop, dine, and enjoy local. We've also been promoting Takeout Mississauga, while restaurants in particular remain closed for indoor dining. Please continue to shop local and support Mississauga businesses. We are pleased that the Government of Ontario has announced a return to indoor dining, fitness centres and arts and culture and recreation facilities on January 31st, albeit with capacity restrictions. And we are hopeful that the plan released by the province leading to a full reopening of the economy happens in March and that they are able to stick to it. Notwithstanding these developments, we are still hearing from our members that government financial supports are not enough, take too long to flow, and lead to more businesses not being able to survive the current wave. As next steps, we are calling for additional investments in testing capacity and business supports to foster a sustained reopening guided by evidence and science. government also needs to be transparent about the data behind the restrictions. Businesses need to see modeling that justifies the nature and timing of response measures and how they are successfully mitigating the virus or alleviating pressure on our overwhelmed healthcare system. If we want a robust and inclusive economic recovery, we need our government to focus on creating the right conditions to support business stability, predictability, and confidence. I want to wish all businesses in Mississauga a stronger and brighter future and assure you MBOT will continue to be there to advocate for your interests and ensure governments at all levels listen and act. Thank you.
Thank you, Trevor. I want to thank you and the entire team at the Mississauga Board of Trade for the ongoing support you've provided to our businesses. From workshops to advocacy to buy local campaigns to your rapid test program, you've helped so many business owners navigate the uncertainty of this pandemic. We're very lucky to have you as a partner here in Mississauga. I also want to give a big shout out and thanks to our city's economic development team who have been critical in supporting our city's small business community, from promoting our support local initiatives to helping businesses with digital marketing and free e-commerce sites. They haven't stopped working for the over 96,000 businesses in our community. I encourage all Mississaugans to please do their part to help businesses get back on their feet by supporting local in the coming days and weeks. They need it now more than ever. And now I'd like to invite up Dr. Lowe for his update. Dr. Lowe, over to you.
Good morning. Thank you, Madam Mayor. Thank you, Trevor. This week, widespread transmission of Omicron continues, but is starting to slow in our community here in Mississauga and in Peel. Our hospitals are still contending with pressures from increased patient demand and decreased staffing, but we are hopeful that this situation will start to resolve in the coming weeks. With schools now back in person and a broader reopening announced to start from January 31st, I want to be very clear that now is the time for all of our residents to get vaccinated or to get boosted. I'm pleased to announce that today, as I did yesterday, that we now have a capacity and supply of both mRNA vaccines to provide boosters to all eligible residents in the region of Peel over the age of 18. Both Pfizer and Moderna are safe and effective and are available at all of our Peel Public Health clinics. If you currently have 2 doses and you are over the age of 18, now is the time to boost your protection ahead of the reopening. The preferential recommendation for 50+ does continue in the sense that we will allow walk-ins for residents who are 50 and over who haven't yet got their booster. But I urge all residents, if you are over the age of 18 and eligible for your booster, please get it without delay. You can book online at peelregion.ca/COVID-19 vaccine or through the provincial booking system. You can even book for our upcoming Doses After Dark events, which will be taking place on Saturday, February 5th at the Save Max Sports Centre and on Saturday, February 12th at Rockwood Mall in Mississauga, with hours extended till midnight. As I mentioned, we are also continuing to accept walk-ins for those over 50 who need a booster, and we're also accepting walk-ins for any eligible resident over the age of 5 who needs their first or second dose. Again, residents 5 and older who need dose 1 and 2, and residents 50 and older who need a booster, you can walk in at any public health clinic if it's more convenient for you. Especially for our children aged 5 to 11, I want to urge again parents, please get your children vaccinated. You can walk in together with your family, get your booster at the same time, and getting vaccinated helps to reduce the risk of hospitalizations, severe inflammatory syndromes, and long COVID for your children. My own child in this age group has now received both their doses, as we got our first dose the first night they were able to do so back in November. I'm grateful because this means a further reduction in risk for my family, no matter what variants of COVID-19 emerge in the future. My call today is thus clear. If you are 5+ and haven't yet been vaccinated with your first 2 doses, now is the time. If you're 18+ and haven't gotten your booster yet, now is the time. Of course, as the surge resolves, we must continue with our other precautions, such as wearing masks in indoor public spaces and crowds, and also staying home if we are sick. But vaccination continues to be the cornerstone to protection both now and as the Omicron wave starts to resolve and we reopen. I know that the past 2 years have been extremely difficult, and I thank our community for standing together and for their collective sacrifices in keeping each other safe. This past Sunday, Peel Public Health marked 2 full years in emergency operations, 730 days, through a response filled with ups and downs in the longest pandemic response in the history of the region of Peel. I'm grateful that so many residents have supported these efforts to keep each other safe through this terrible generational health crisis. In fact, earlier this week, as Mayor Crombie mentioned, we hit the incredible 90% 2-dose milestones for residents 12 and older vaccination coverage. Thank you to the residents who stood up to protect themselves, their loved ones, and their communities. Despite all of our challenges and barriers, Peel has come together through the 5 waves, first by staying apart to keep each other safe, and then getting vaccinated when it counted. Our 90% first dose and 83% 2-dose coverage for residents aged 5 and over stands above the provincial average. It made the difference against Delta, and it is currently making a crucial difference in also protecting our residents and our hospital system. We've accomplished it before, and we can do it again. So I urge you all to come out. Let's achieve the same heights with boosters and protecting our youngest residents aged 5 to 11. This is our call to action ahead of reopening. Please visit peelregion.ca/COVID-19 vaccine to book your appointment today. And again, if you are over 5 and need your first 2 doses, or over 50 and need your booster, you can walk into any public clinic as soon as you are able. Thank you very much, Madam Mayor, and I'll pass it back to you.
Thank you as always, Dr. Lowe. And I do want to echo what Dr. Lowe has said about the importance of getting vaccinated and boosted. As we move forward with the reopenings, the single most important thing you can do to ensure our businesses and our city facilities stay open is getting your vaccine. And while we've made huge strides in getting 2 doses to the vast majority of our residents 12+, as well as getting more shots into the arms of the 5 to 11-year-olds, we need more people to step up to get their boosters. Well, 2 doses gives you some immunity. Protection against infection decreases over time, particularly against the Omicron variant. 3 doses, on the other hand, not only provides better protection from getting infected in the first place, but in many cases also reduces severity. Dr. Lowe and Peel Public Health continue to work to make it as easy as possible to get boosted. Just last week, we opened a new fixed clinic at Rockwood Mall, and we have pop-up and school clinics running each and every day. And I'm happy that Peel Public Health is launching 2 more versions of Doses After Dark, our successful pop-up clinic that provides residents with the opportunity to get their vaccine all afternoon and evening. The next one will be held on Saturday, February 5th from 1 p.m. until midnight at the Save Max Centre in Brampton, followed by one at Mississauga's Rockwood Mall on February 12th from 1 p.m. to midnight once again. We also know that some residents have been hesitant to get boosted because they were only being offered Moderna due to the shortages. The good news is that we now have both Pfizer and Moderna on hand and available, which are both excellent, and all residents over 18+ should get their boosters as soon as possible, especially with the reopenings happening this Monday. Before I take questions from the media, I just want to say a few words on the childcare negotiations taking place right now between the province and the federal government. I know the province is working hard to get the best deal for Ontarians, and I hope we can see something finalized very soon. The cost of childcare is out of reach for far too many families in Mississauga, and there is an incredible opportunity in front of us to slash childcare costs in half by the end of the year and bring $10 a day childcare to families within the next 5 years. The sad reality is that the pandemic has affected women far more than men, often being dubbed the she session, with many women scaling back their careers or leaving the workforce altogether to look after children. If we're truly going to have an inclusive economic recovery and get more women back into the workforce and into senior leadership positions, we need affordable childcare now. I really look forward to hearing some good news, some positive news from the Premier and the Prime Minister very, very soon. Now, along with Dr. Lowe and Trevor Mcpherson, we're all happy to take questions from the media.
Your first question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Mayor Crombie, how are you?
I'm very well, Steve. How about you?
Not too bad. With the city facilities opening up again with limited capacity, I thought I would ask you about where the city is at with staff vaccination rates. It's a two-parter. Do you have up-to-date information on what the vaccination rate is among city staff? And were there any staff kind of let go as a result of the vaccination kind of policy?
There were very few let go. I can send you those numbers directly. I think it was under 5 for sure. The vaccination rates are very high. They do exceed the provincial, the provincial average, and maybe in line with the Peel average. And the other question was let go vaccination rates. We are operating at, I think, 88% capacity, and with less than 5% of our workforce being off due to Omicron, due to exposure or isolating because a family member was exposed. Mm-hmm.
And then just to clarify, you said there's around 5 staff that may have been let go?
No, I said much fewer than 5.
Okay, much fewer than 5.
Mm-hmm.
Just a second matter here. It looks like this truckers rally thing is going to be passing around Mississauga today on the 401 and QEW. I guess one question I had is, have you heard anything about kind of potential delays for Mississauga motorists? And do you have a general kind of comment on this rally?
So certainly everyone is concerned about the delays this may cause. I had my own staff members come into work exceptionally early, concerned about this. But what we do know is that the vaccines work. So what we wanted to ensure is that everyone, including all those truckers out on their convoy, they have the right to protest, of course, peaceful protest, but we want to ensure that everyone goes out and gets vaccinated because vaccinations work.
Your next question comes from Declan Finnegan at Mississauga. Go ahead, Declan.
How are you?
Oh, good morning. I'm fine, Declan. Thank you for joining us.
Premier Ford suggested this week that he would support reintroducing the city centre transit loop as part of the Hurontario LRT if developers contributed to the cost. Is that doable at this point?
Well, you know, that was great news. I heard that in his interview as well. However, first, we don't know what the estimated cost for the loop is. Of course, you know that they are funding the balance of the line, and it is Metrolink's project. I think it would be very worthwhile that we do that analysis, but we right now don't have those revenue tools in place to ask those developers to make those kinds of contributions. So there would have to be some adjustments, but certainly it's something we can consider. I would go to any measure, use any measure I have at my disposal to ensure that that loop does get built.
Follow-up, Declan?
Yes, for Dr. Lowe.
Certainly.
Thank you.
We'll invite him to the podium, Dr. Lowe.
Morning, Declan.
Morning, Dr. Lowe. With the opening of the Rockwood Mall clinic last week, I know there was a hope that that would help improve vaccination rates in specific parts of Mississauga where there previously had been concern. Can you say today, Dr. Lowe, that you're pleased with the vaccination rates in those areas of the city, or is there more work to be done there?
Well, Declan, the clinic's been open for a week, so it is still very early days. Of course, we have seen significant volumes at the clinic, and of course, as I mentioned, now with having both mRNA vaccines in adequate supply available on hand here in the region of Peel, we've also started to see an uptick in appointments and bookings, not just at Rockwood, but throughout the system. But I think my message today couldn't be clearer. At this point in time, as we're heading into reopening, your best protection against severity, and hospitalization is to get vaccinated, 2 doses as a primary series, as well as a booster. So anyone who is 5+ who doesn't have their 2 vaccines, anyone who is 18+ and doesn't have their booster, I urge you to get vaccinated without delay. I also urge those who are, particularly our children 5 to 11, as well as those over the age of 50, you can walk in. First 2 doses for anybody over the age of 5, and also boosters for anyone over the age of 50. Vaccinations, 2 doses plus boosters, remain our best protection, and especially as contacts will increase as we continue in this period of transition with Omicron and reopening, I urge all of our residents to access their first 2 doses and a booster today. Thanks so much for the question.
Thank you. And to the next question, please.
Your last question comes from Khalid Salama at My Second Home TV. Go ahead, Khalid.
I know you work closely with the Trillium Health, and my question is when you think the surgeries will resume.
So this is provincially mandated, I think, Khalid, but I'm just looking at my numbers here at Trillium Health Partners, and they're looking
I can't hear you. You
can't hear me? Can you hear me now? Can you hear me now? So Khalid, the numbers are improving significantly, and we have a lot of hope that our surgeries will resume very soon. So we are seeing about 125 patients with COVID in the hospital and about 30 in the ICU, and that is down significantly from last week. But why don't I invite Dr. Lowe up to talk about elective surgeries and when he sees that back in full force. Dr. Lowe?
Thank you.
Yes, thank you, Madam Mayor. Thanks, Khalid, for the question. It's important to remember that as with any wave, you see the transmission occur first, and then subsequently the hospitalizations, and then subsequently the mortality. Fortunately, what we've seen is we have a more mild variant in circulation, which means that most of the transmission has not translated into severity in the hospital system, but that doesn't change the fact that hospitalizations and challenges to hospital capacity will always continue to lag that initial wave and surge. I think what you're seeing in reopening the community is where the storm has passed through, you're able to start navigating ahead. So, for example, schools, and then moving forward with reopening other certain public settings in our community. Hospitals are still contending with the significant demand at this point in time, though the admissions are starting to slow. And of course, we're very hopeful that the province will revisit Directive 2 at a point that it is appropriate, so that people can then resume hospitals and healthcare surgery. So this is essentially just a temporal cascade, and it's likely that once the hospitals are through, which will likely be in the next few weeks, we'll hopefully see the ministry review Directive 2 and work with our hospital partners to get other life-changing and life-supporting surgeries started again. Thanks so much for the question.
Sure. And my follow-up also, both of you, do you support and recommend adding the COVID to the essential immunization for schools?
I certainly, Cal, it's a great question at this point in time. One of the interesting things about our existing Immunization of School Pupils Act is that it has opportunities for philosophic exemptions, which is not necessarily in line with some of the approaches we've taken around the importance of getting COVID-19 vaccines at this point in time. So I think it's obviously going to be a provincial decision. I support any measure that would essentially protect our children. We know, especially having children in this age group myself, how vital it is for children to still have this protection against long COVID, against severe inflammatory syndromes, that peace of mind that comes from their day-to-day interactions and letting them just interact in an ordinary manner. I think ultimately my recommendation is for parents to get their kids vaccinated as soon as possible, and certainly I would voice my support for any policy or any approach should it be proven that a policy of that nature might help at the provincial level. I support anything that essentially will make sure that our children can access the protection they need. Thanks so much for the question.
Khalid, I just concur with Dr. Lowe. We encourage everyone to get vaccinated, as we know it provides greater protection for them from severe illness and hospitalization, obviously, as well. Thank you. Next question, please.
That was your final question.